greatly higher for African Americans. Will the Cancer Moonshot Initiative actually save Black lives? Joining us now to talk about this is family medical physician Dr. Marie Elizabeth Ramas. Good to see you again, doctor. Tell us, how can the Moonshot Plan help to close the cancer disparity in the Black community?
Well, I hope that the Moonshot Plan can address the clear deficit that we have in both access and intervention processes that we have in our communities. We know that African Americans in the United States have less detection rates compared to their white counterparts, and unfortunately also have less access to early prevention and early treatment opportunities as well. And so we can't deny that we have to take care of the systemic issues and increase access and treatment opportunities for those communities.
Well, prostate and breast cancer death rates are especially high for African Americans. Are there parts of the initiative specifically focused on areas where African Americans need the most help?
One of the areas that it does focus on is increasing funding for early detection and prevention services. But what we do find in the Black community in the United States is that African Americans tend to get prevention services later than other race and ethnic communities. And so, what is important is that we, one, incentivize those communities to, one, trust our medical facilities. And then also, we incentivize particularly our primary care offices to have these opportunities for our Black and Indigenous communities as well. Right now, we're lacking in those areas.
So, Moonshot also plans to improve the experience of people and their families who are living with and surviving cancer. How will Black families benefit from that part of the plan?
One of the areas that I focus on as a family physician is bringing culturally appropriate and relevant information for my families, and particularly for other communities of color and those who come from different areas of the world. Concepts like cancer can be difficult to breach within a family setting. And so it's important that we include culturally appropriate and effective training for our medical and healthcare professionals in order to talk about this subject in an effective way. Not every culture wants to talk outright about the C word. And so we have to be very mindful about how they best receive that information to make the best and conscious decisions for themselves.
So, what do you recommend for people in the community who are struggling to afford the care they need?
So, one of the great areas that we have here in the United States are federally qualified health centers and community health centers. And the principle behind those particular facilities are indeed to help improve access to care for the most indigenous populations and those who are underinsured. And so, certainly, reaching out to a community health center is of importance. Another opportunity to get help would be to reach one's public health department, because more likely than not, we do have programs state by state that fund for particularly breast cancer and colon cancer screening. And so if we have listeners that are interested in getting more information, you can start there if you don't have a family physician already.
All right. Thank you so much, family medicine physician Dr. Marie Elizabeth Ramos. Thank you so much for joining us. And real quick, happy National Women's Physician Day to you.